Dear doctor and friends, I will go first to present the first chapter of the student project, Introduction. My name is Natalia with the 3 last digit student number 109. First, the background. Palliative care is defined as an approach to improve a patient's quality of life in the brink of life-threatening illness. The focus in palliative care lies in the prevention and relief of the symptoms, along with the assessment and treatment of other problems regarding the patient's physical, psychosocial, and spiritual aspect of life. Communication between healthcare workers, palliative care patients, and their families is considered a central component in end-of-life care. Due to this importance, the author are interested in delving deeper regarding the importance of communication in palliative care. Next, we move into the problem formulation of the student project. First, what is the definition of palliative care? What are the components of palliative care? What are the goals of palliative care? What are the approaches to palliative care communication? What is the preeminence of communication in palliative care? What are the ethical aspects of palliative care communication? What are the implications of communication in palliative care? And what are the barriers to communication in palliative care? The objectives of this student project is written in this slide. They basically are for answering all of the problem formulations from slide before. Lastly, the benefits of this student project. The first one is to improve student knowledge regarding multi-aspects of communication in palliative care. Also, to increase one's understanding of the definition, components, goal, approaches, preeminence, ethical aspect, implication, and barriers of communication in palliative care. And the last one is to serve as a reference for future related research. That's all from me, thank you.
Hello, my name is Siwa and my last digit number is 016, and I will explain the definition of palliative care. So palliative care is a specialized medical approach designed for individuals who facing serious illnesses. Its primary goals is to alleviate symptoms and alleviate the stress associated with the disease, often administered alongside curative treatments. This form of care is centered around the patient's needs rather than their prognosis and starts from the moment of the diagnosis. A dedicated team of healthcare professionals, including doctors, nurses, and specialists, delivers this supporting care, aiming to enhance the patient's quality of life. The focus is on empowering patients, giving them control over their treatment options, and reducing the impact of symptoms and stress related to their condition. And palliative care can be provided in various settings, such as hospitals, nursing homes, outpatient clinics, and even in the patient's own home. That's all from me. Thank you.
Allow me to introduce myself. My name is Carla Noveline Manullang with my last three digits are 146, and now I'm going to present about the components of palliative care. So, palliative care is medical treatment given to patients and their families who have a serious disease with the intention of lessening their suffering and enhancing their quality of life. Down below are the components that is essential to adequately meet the needs and the preferences of patients and their relatives. The first one is teamwork within and across settings. Next one is symptom and pain management, treating both physical and non-physical symptoms holistically, having the right people on the team, timely and responsive, and also patient and family preparedness. That's all from me. The next part will be continued by my colleague. Thank you.
Hello everyone, my name is Dewa Agung Guptha with the last three digits of name is 072. Today I'll be explaining you about the goals of palliative care. There are two aspects to which palliative medicine is focused: the role of psychosocial support and aggressive symptoms management. This is true unlike hospice care that depends on prognosis related of the patient approaches. The goal of palliative care is improving the patient's quality of life and also the family. That's all from me. Thank you for the time.
Thank you for the opportunity. My name is Ningrum, and I will explain about the approach to palliative care communication. Implementing palliative care requires good communication between professionals and also in communication with patient. This is to create an optimal team in carrying out care. With communication between professionals, many decisions can be resolved with satisfaction to improve individual competence. These decisions are related to management, building trust, and advocacy for patient, and can increase the knowledge and experience of each professional. Health professionals often experience challenge communication with patients when conveying bad news such as life-threatening illness or difficult, uncertain questions. Apart from that, sometimes patients also prefer certain team members over others. Therefore, the team in palliative care needs good communication so that patient can accept each different characteristic.
My name is Gede Renathan with rigid last to number 193, and now I will explain about the preeminence of communication in palliative care. Effective communication is a critical component of palliative care, enabling the provision of care that is aligned with the goals and preferences of patients and their families. This involves exchanging information, facilitating shared decision making, and fostering empathic relationships. Palliative care providers should assess patient communication preference and willingness to accept their prognosis and tailor the amount and delivery of information accordingly. Patient-centered communication is not only a measure of healthcare quality but has also been shown to improve health outcomes in palliative care, where patients are often accompanied with loved ones. It is essential to include all relevant stakeholders in important discussions. Effective communication can introduce patients and families to palliative care in a non-threatening manner, build trust, manage symptoms, enhance coping, and guide treatment decision making. Palliative care providers should have the skill necessary to engage in this common but critical conversation, which are essential for promoting quality of life and well-being of the patient.
My name is Nandhita Naaz with the last digit of master number 189, and now I will continue the presentation about the preeminence of communication in palliative care. There is a potential that effective communication will create safety, connection, and understanding. It is a fundamental component of excellent healthcare, and in many areas of medicine, language plays a crucial role in healing, but when a patient is given a terminal prognosis, words may have even greater therapeutic value. Language has the power to inspire hope and respect the person who is ill, even in situations where drugs and life-saving measures are not as important. It can be difficult for patients, their loved ones, and their communities to accept that, and in these situations, communication is essential to recovery. Patients appreciate honest, compassionate communication that is practical and involves exchanging information in a way that allows the best decisions to be made. Effective communication has many advantages, such as promoting reconciliation in relationships, improving information interchange accuracy, and improving uncertainty management.
Okay, thank you for the opportunity. My name is Wilbert Purnamasidi with last digit of my student number is 135, and now I will explain about the ethical aspect of palliative care. So first of all, we need to know what is ethics, what is medical ethics. So principally, medical ethics is moral principles, values, and guidelines that govern the conduct of healthcare professional and the treatment of patients within the field of medicine. And why ethics is important in palliative care? We need to back to the basic that every human is unique and sensitive nature of their circumstances and involved in caring for individuals facing life-limiting diseases. And the last one is what are medical ethics? Medical ethics have six aspects such as autonomy, beneficence, non-maleficence, justice, dignity, and truthfulness and honesty. And the more details will explained by my friend. I give it to my friend. Thank you.
Thank you for the opportunity. My name is Gede Aryana Saputra with the last three-digit number of NIM 018, and I would like to discuss with you guys about the ethics in palliative care communications. There are six main principles in ethics in palliative care communications. The first one is autonomy, where patients have the right to make treatments of choice even in palliative care, and healthcare providers must respect and support this autonomy through open and empathetic discussions. Beneficence, healthcare professionals should act in the best interest of the patients, actively seeking to enhance their well-being and comfort. Non-maleficence, the principle first do no harm, requires a balance between improving the patient's quality of life and avoiding unnecessary suffering. Justice, ensure equitable distribution of health resources, addressing disparities, and providing the best possible support to all patients. Dignity, upholding the inherent dignity of patients is crucial, and communication should be characterized by empathy and compassion, respecting the unique needs of its patients. And finally, truthfulness and honesty. Patients have the right to know the truth about their conditions, and a healthcare provider have an ethical obligation to provide open and honest information to enable informed decision making. Thank you.
Hello, my name is Margaretha Jesslyn with my last number is 248, and now I will explain to you implication of communication in palliative care. So communication play a pivotal role, and first one is effective communication is essential for addressing physical symptom, managing pain, and also address physiological, emotional, and social needs. Open and compassionate communication, building trust, providing emotional support, ensuring that patient and families' values are honored. Empathy and active listening. This creates an environment where patient and families feel valued and thus create a foster a sense of trust and collaboration and ultimately better outcome. And then, however, challenge in communication within palliative care are evident with an end of life care can be particularly complex and sensitive. Healthcare often struggle with initiating conversation and effective communication and also address cultural, religion, and spiritual aspect. And patient and their family come from diverse background. By acknowledging this, we can provide a patient-centered care and involving family member as they are the primary caregiver and source of emotional support for patient. Thank you.
Hello, my name is Kevin Andrian Candra with my class G number 095. Today I will continue the explanation of implication of the communication in palliative care. Communications is essential in palliative care for addressing physical symptoms, pain, psychological, emotional, and social needs. Effective communication involves empathy, active listening, and the ability to engage in difficult discussion about end-of-life care. Open and compassionate communication is crucial for building trust and providing emotional support to patients and their families. Healthcare professionals should be culturally sensitive and respect the diverse cultural, religious, and spiritual background of patients and their families. Family involvement and support are critical in palliative care, and effective communication with family members is essential to ensure they understand the patient condition, prognosis, and treatment options. That's all from me. Thank you.
Hello, my name is Adrianus with the last three digits of my student ID number 104, and I'm going to explain about barriers to communication in palliative care. So there's 5 points, and the first one is training and education for health professional. So health professional with skills in conversation and training programs in emotional intelligence, cultural competency, and effective communication strategy. The second one is teamworking and coordination among health professionals in order to overcome communication barriers and deliver comprehensive and patient-centered care. The third one is communication skills to continue building trust and enhance the overall quality of care in the palliative setting. Next is the time and availability to allow patient to express concern, ask questions, and share emotional response. And the last one is emotional, cultural, and psychological factors, which is subjective based on the patient's culture.
My name is Aisyah Taqiyyaa with Trilas JIT number is 076. Chapter 3 Conclusion. Summary. Palliative care is a specialist medical approach designed for individuals facing life-threatening illness. Effective communication in palliative care is a critical component of palliative care, enabling the provision of care that is aligned with the goals and preferences of patients and their families. Effective communication can introduce patients and family to palliative care in non-threatening manner, build trust, manage symptoms, enhance coping, and guide treatment decision-making based on patient family-centered. Ethical considerations in palliative care communication are deeply rooted in the six core values of medical ethics, which are autonomy, beneficence, non-maleficence, justice, dignity, truthfulness, honesty. Advice. A holistic approach and advanced skill from the team palliative in communicating what patients and family wanted and needed have a significant impact to outcomes patients. That's all for us. Thank you.